And with that, Lauren Dudek, so I'm our Senior VP at Lumisque, home of CO2Lift, CO2Lift Pro, and CO2Lift V. Been with the company now for 3 years. Very happy to be here. And joining us live from Southern California, hopefully sunny there, is Dr. Nykiel. Yeah.
It is. I got to move out of the sun setting right now over the ocean. So if you see it, you'll catch it every once in a while. So I got to move. It is still sunny.
Love it. Okay. Well, I'm Dr. Nykiel. I'm just going to turn it on over to you. So, we met almost a year ago. I feel like we're coming up on our anniversary now.
We did it at ASAPS.
ASAPS in Vancouver, and you've been kind of using the CO2 lift since then. So I'm excited to hear about your feedback, your experience, and how it's been working for you.
Love it. Okay. All right, everybody. So like Lauren said, I've been using this for just under a year. It was April of 2024 when we started to use it. I'm really excited to talk about it, and I hope to give some insights on it. And for those of you who've ever seen me talk on other products, I'm very open and honest about things, which is positives and negatives. I think sometimes the companies don't like it, but I think if you're here listening to it, it's good. And in full disclosure, in fact, I shot a podcast a couple days ago with Dr. Franco and Lana about this. I wasn't really, I found this hard to believe that this product would work, and I've been pleasantly surprised since then. So I want to run you through that. With that sort of undertone going through it, I was a skeptic of this in the beginning. So let me just jump in here. What we're going to do today I want to actually run you through carboxy therapy because I knew very little of it. And so I think once you understand this, you're going to understand that how this has potential applications. And I want to review those applications because, again, once you understand the mechanism of carboxy therapy, you're going to understand that this can actually be used in a number of areas in your practice, and it can actually be extremely helpful on a surgical side. It can be extremely helpful on a med spa side, and you can use it in intimate areas, vaginal, penis. It has a wide application basis. I want to actually talk about how I found the CO2 lift because I think that'll just give you a little bit more insight into my talk here and understand how we came across it and actually how we've continued to use it. We're actually doing a research study for CO2 lift on the scar research involving liposuction. It's early on in the study, but I just kind of want to mention it and talk about it. And then I want to close this out. It's no, I think, sort of secret to anyone that the economy is not necessarily the best in aesthetic world, right? I mean, people have seen a decrease from companies, et cetera. And I want to actually talk about how we utilize CO2 lift specifically to leverage the consult experience, how we actually, once we started to do that, realized we could actually predict consult behaviors based on whether or not they got CO2 lift. And actually, I want to show you how we then utilize all that data to actually help to drive our conversion. So actually, because of this product, we actually have a better sales conversion rate. And I think that's super cool. That's actually how we're going to end the talk. My whole goal is this is going to take us about 30, 35 minutes. I know on the East Coast, it's like already 8 something over there. So I appreciate everybody taking the time and spending with me. For those of you who don't know me, I'm Dr. Matt Nykiel. I've got 2 offices, Newport Beach and Upland. We have a med spa over in Upland. I've got a surgical office over in Newport. I do a lot of body sculpting. It's something that I really enjoy. I've done both aesthetic fellowships. I've done micro fellowships. I'm a board certified plastic surgeon. Do you have some disclosures to make? I'm actually on the advisory board and a paid speaker and trainer for Vaser. I'm a paid speaker and trainer for Renuvion and Shape Skill and some other things. I review papers, etc. All right, so let's run through. So the idea of carboxy therapy was a completely foreign concept to me when I first heard of this. And so I just want to take a minute and sort of explain sort of what it is. So in the simplest way, I want you to think about it. Prior to topical gels and treatments, a needle would be put underneath your skin, and the needle would actually infuse carbon dioxide. And if you infuse carbon dioxide, as we know, in the medical space, our skin and soft tissues don't like that. In fact, our skin and soft tissues are going to think, oh my goodness, we have a problem. There's some type of blood flow issue. CO2 is building up. We need to actually open up our vessels to both get oxygenated blood in and remove that CO2 out of there. Now, the idea of putting a needle underneath your skin and then injecting or soufflating your soft tissues with CO2, they said wasn't painful, but honestly, to me, it seems like it's a painful thing. And I think that's part of why it really never caught on in the US. They did it in Europe, but it really never saw the light of day in the US. Fast forward now that actually through, just science engineering feats, they actually learned how to create a CO2 topical gel. And by having a CO2 topical gel, it would actually transdermally be absorbed into your skin. So the effects of that carboxy therapy were still happening, but without needle or insufflation, which makes this way more tolerable, which means that patients are more apt to do it. And also just patient compliance is higher. The process still is the same where the CO2 gets absorbed. Your body says, oh my gosh, I think we got a problem here. I've got huge levels of CO2. Open up arterioles, open up our venules. Let's move blood in and out of here as quickly as we can, bringing healthy nutrients, etc., to the skin and soft tissues. And we're going to talk about the downstream effects from that. So this is actually, I think, one of the coolest slides, and this is like the mechanism in action. So what are we looking at? We're actually looking at the microcirculation, and we're looking at the difference before and after sort of topical treatment. And what do you see? You can actually see dilated, opened up vessels before and after treatment, which is exactly what we would expect to see if the body thought that they were having either an ischemia or blood flow issue. They're opening up those blood vessels, and that's going to deliver more oxygenated blood and nutrients and minerals to our soft tissue. And that's the idea of the carboxy therapy. And this is sort of showing it to you in these images here before and after treatment. For those people that really love science, this is the Bohr effect. Basically, we bump the carbon dioxide levels up, and it gets absorbed more. Your body says, oh no, we need to move that out of here. We got to bring some oxygenated blood. We get some pH changes that help to drive this. As you remember, CO2 sort of dissolves in it. Super cool. I'm not really sure that's, for those of you that love the science and engineering side, that's it. Read up on it more. Now, here's something super cool. Again, histological evidence. We're actually looking at vaginal tissue, which is one of the areas that we can actually apply this through. The CO2 lift is actually called the CO2V lift, and we'll show a couple slides on that. But look at the difference post-treatment after this goes. We can see that we have just thicker, healthier sort of, epithelialization cells in there. And this is actually what we see in practice on the vaginal rejuvenation side or on the facial side. And we're going to get into to uses for the surgical side too. Another really cool slide, and I kept this in here because this is actually one of the reasons that we found this. And I'm going to jump into this more. But essentially what I want you to see is they treated the skin with the CO2 lift. And then when they did a whole bunch of measurements with actually meters, whether that be a dermatospectrometer, whether that be a corneometer or an elastometer. But look at this, 117% increase in hydration that lasted up to 3 weeks. That's incredible. And that's actually the main sort of feedback that we get whenever we utilize these for patients in a consultation experience or whenever we use them on the face, etc. My wife too, that was one of her things that actually drew her to this product, was just how much hydration, smoother, softer the skin felt. So I threw this slide in because I think that this is important. Like anything in life, if you Google something, you're going to have a whole bunch of different stuff pop up. So just because it says it's a CO2 or carboxy therapy does not mean that it delivers the same treatment. So I just want you to be aware that there are sort of knockoff brands out there. There are people that claim it's a similar thing, but actually when you look at double-blind studies, when you actually look at the research, CO2 Lift has it to back it up. Okay, so we understand the mechanism of it. Let's sort of take a look at where we can use this product, and let's look at some examples of it, because I think you're going to see how cool this product is and why I have really come around to this. So honestly, basically from head to toe, you can use this in everywhere in between. So let's jump in and start to look at this. Okay, no one likes wounds. As a plastic surgeon, I really hate wounds for a couple of reasons. One, we would love it in most plastic surgery is elective surgery. So while there's risk to any surgery, complications are always possible. We try to minimize those as best we could. So if we could drive more oxygenated and nutrient-rich blood to the tissue, we should be able to then improve wound healing. And that's exactly one of the things that we've seen with this, specifically when we look at diabetic ulcers. And for those of us who either have been in that space or are currently in that space, diabetic ulcers are a really tough thing to treat. And being able to utilize a topical gel that can easily be applied at home is a complete game changer in one of the areas. Obviously, if we can heal diabetic ulcers, you're going to start to say like, well, wait a minute, can this work on other wounds, other non-healing areas? And the answer is yes. Let's take a look. Okay, so I think that this is actually another great thing for those of us that work with radiated tissue or have worked with radiated tissue or work in the radiated space within medicine. You know, radiated tissue is extremely difficult. It's very hard. It's very non-compliant. It can get irritated a lot. It doesn't heal that well. So here's actually examples that we have of the radiated tissue. Again, CO2Lift Pro, this is after 2 treatments of it. And you can see how much that tissue has just significantly improved. And I want you to start to think about this now. You say, well, wait a minute, this sounds very similar to hyperbaric oxygen treatment. And I think that's similarly how I want you to think about it. I don't replace my hyperbaric oxygen therapy treatments. I use this as an additive because unlike hyperbaric oxygen therapy, where the where the patient has to go. They have to basically actually, sort of spend 60 to 120 minutes in a compressive tube. This is able to be applied and people can go about their life. So we're able to add that on to this and really see some benefits from it. And again, I think this is just an amazing application here. So there's actually, I have a couple of my office staff that have psoriasis, and they're the ones actually that asked me if they could use it for psoriasis. And truthfully, I don't know if it works or it doesn't work. I said, well, yeah, if you want to try it. Interestingly, both my employees that have it really speak to the hydration fact, the fact it just feels like temperature-wise cool, calming of the skin, and actually they just sort of, their skin feels softer and just more moisturized from my two employees that have psoriasis. So it's been actually really cool there. All right, this is actually, again, one of, I think, the really neat spaces for those of us who are in any type of surgical or procedural medicine, because ischemic tissue can happen. And look at this. We're actually looking at the base of a penis here, post-op day 3. And anytime that you would see skin that looks like this, that's not good. The chance that that's going to survive, I think, is 0. And really, you're sort of thinking in your head, okay, I'm going to have to do some type of, I usually use Silvadene twice a day until that eschar finally lifts itself up. And then we can sort of talk about what we're going to do after that. But in this case, look at this. Here you are. 9 days later. And again, that is amazing, given how black and dark that skin looked before. And that's the things that when you utilize this product and you start to actually integrate it in, you realize, yeah, that actually made a difference. Now, I want to draw to your attention, because this is the really cool thing, because for those of us who have ever dealt or utilized hyperbaric oxygen treatments, when we see skin that looks like this, the negative of the hyperbaric oxygen treatment is we have to have availability. Sometimes we've got to actually call to have personal favors done in. We have to get the patient over to there. Sometimes there's a ride issue. They have to be able to have that much of their schedule cleared. This is basically, you can see 1-2 treatments that were delivered twice a day. People can do it at their house. They don't have to actually go in and sort of clear their schedule. They're able to put it on and just go about their day. And that is a huge changer in us being able to deliver treatment. It's also super cool because you're able to give patients something to do. And for those of us who have been in the practice of medicine for decades, sometimes just the psychological treatment of a patient and helping them by just giving them something to do is very calming and beneficial. This product actually works, which is really nice. And we're giving them something to do so they feel like they're also being proactive in their healthcare. Again, take a look at this photo. This is actually a super cool. Look at this, Morpheus 8. So for those of us that utilize any type of sort of these, quote unquote, minimally invasive, non-invasives, they inflame the skin. They make it angry. Look at these treatments 1 day later after CO2 lift. For anybody here that has ever used radiofrequency treatment, that's just not likely. Not impossible, but it's just really not likely, given that's how we look like sort of after the procedure, and that's how we look like once we apply it. And that's the cool thing that we also see with this CO2 lift, is its ability to remove inflammation and erythema. It's absolutely awesome. Okay. Couple more examples I want to show you, because again, what about even the less invasive side? Oh, I see a chat thing here saying can't hear. Can you hear me, Lauren? Yeah. Okay. Sweet. Okay. Thank you, Paula, for telling me. Okay. Now, how about less invasive side? So we're starting to see wrinkling, etc., decreasing after treatments. And I'm going to be the first to tell you, when I see photos like this, I'm usually like, okay, what's the rub? What's the scam here? And I really start like looking at the photos, looking at the angles, looking at the flash, looking at the colors. But I can tell you, as someone that uses this product, and I have, and employees love it, my wife loves it, I can tell you I'm more apt to quote unquote believe this, and I've seen the result of it, and that is from that hydration, from that plumping, from that volume. I absolutely have seen my own skin look like, number one, it has a better glow. The skin tissue is sort of fuller because it's just better hydrated for sure. All right, again, look at this photo. Super awesome. So we've got CO2 lift, no CO2 lift. So a truly controlled trial went immediately after procedure. And look at this difference 3 days out. And that's awesome. Now, obviously, I'm with you. The light is coming from that right side. But overall, look, you can just see it's less inflamed, less irritated skin. 100%. And that is just a theme I hope that you're sort of understanding, because that is what we see too, which is similar, right, to what we see when we actually do hyperbaric treatment and when we deliver oxygen-rich sort of when we deliver oxygen-rich nutrients to the skin and soft tissue, we're just doing it in a different way. Instead of bumping that pressure way up, we're just tricking the body into thinking, oh, this is a sort of oxygen depleted environment, and the body sort of gets the oxygen in sort of a roundabout way. But results are similar, which is awesome. Again, okay, so for those of us in surgery, I included this photo too because this is awesome, because look at that nipple on the right. That's a scary photo. So this is, to my knowledge, there was no hyperbaric oxygen treatment with this one either. And I'll be the first to say that wouldn't be me. I would send this person right to hyperbaric oxygen just because of how that right nipple looks. I'd be that scared. But for whatever reason, they couldn't go. Maybe there was no availability or they couldn't get in, et cetera. So they did the CO2 lifts, in this case, every couple hours. And I would too if I was in that situation and I couldn't get out. But look at the change in that. Now, you see some at 2 weeks. You do see some epidermolysis. You see some areas of irritate, but overall, that's a really nice change. And that is more and more what we're hearing from all the surgeons that utilize this is just, man, I was in a bind. Was one of my last options. I tried it and actually it worked. Again, just decreasing inflammation and bruising. Yes. Here's a neat photo too that I included in there. I think this one's actually from Hoyos himself. Look at that, especially below the belly button. Look at that woody, indurated, just irritated tissue from that inflammation. Treated it with CO2 Pro Lift. There you are, post-op day 2. I mean, just amazingly not getting out completely, but significantly decreasing bruising, significantly decreasing inflammation. Overall, just an amazing change. And that is absolutely what we see with this product. Okay, so I think I've shown you sort of all the surgical applications. I've shown you some of the non-invasive applications, both from lasering to even fine lines, et cetera. There was a plethora more, actually. If you want to see more photos, reach out to Lauren and the team, and they'll get it for you. I just, with the not wanting to keep you here forever, I kept the highlights that I thought would get you guys in there. Okay, but I do want to talk about this because this is actually super cool. Another application of this product that I don't think would necessarily right away pop in anybody's head. I showed you the histology actually showing the increased sort of cells and cell layers of the vagina itself there, the labia. So you could see that. And so they actually have a product, CO2 Lift. It's slightly different. It's a little bit pH changed, and they added a couple other ingredients into it. You see the pH levels closer around 4.5, and there's a couple other extracts, etc. Honestly, I'm not an expert on that, so I'm not gonna go into, but basically, like med spa type nice stuff. But here's where stuff gets cool. So you may think to yourself, well, okay, you're delivering oxygen rich blood. We're getting more nutrients and minerals. We can see that we have thicker cell layers to the vagina. What does that affect it at all? And so again, there's that histology slide that we showed, thicker epithelium. So it's interesting. Here's the study was done. 50 postmenopausal, menopausal women. They ranged in age about 40 to 70. They did their treatments of, and Lauren can correct me, I believe it's 5 treatments every day of the CO2 lift. Correct, Lauren?
Times 2.
Times 2. So 14 days. 10. I'm sorry.
10 total, Monday through Friday. Yeah.
My math is not good right now. Okay, so there we go. Okay, and look at what their results were, all these 50 menopausal and postmenopausal. And honestly, I'm going to hit up what I think everybody's going to care about the most. And that is, interestingly, arousal is way up. Orgasms is way up. If you were having pain with sex, it's actually down. And all of these are statistically significant. Desire's up, arousal's up, satisfaction's up, pain's down, orgasms are up. Again, orgasm's not to a statistically significant, but the rest is, and that's pretty cool. Awesome. Okay, so how did I find this product? I think that I just want to run you through this really quick because I want you to understand sort of how I got here myself, because hopefully this will help you. So I was lecturing at ASAPS in Vancouver, and my wife will come with me sometimes to these meetings and stuff. And while I was lecturing, she sent me this photo of herself. And I was like, what is going on here? And she actually found the CO2 Lift booth. And I believe they just said, hey, do you want to try a mask on? And my wife's not in medicine. She's in the tech world. And so she's like, yeah, I'm sure, I'm happy to do a mask. So she gets it done and she sends this to me. And that, it's, for those of us obviously that go conferences, they're exhausting, right? So I was talking at a couple different meetings. I did like a dinner talk too. She nicely's tagging along, but super early mornings, plane flights, talking, super late nights. She just felt like she just looked tired and her face was swollen and irritated. So this is after one treatment of the CO2 lift. She sent it to me. She said, look at my skin. It's got like a way better glow. It's smoother. It's softer. It helped take out some of that inflammation that was in my face, but you can actually see just my face contour a little bit better. You got to come check this out. Look at this product. And honestly, I was skeptical, but my wife tells me to do something. I'm going to do it because I've been married for 10 years and I want to continue to be married. So I went there. And honestly, I was interested. And we had a couple of our employees that were there too. And they said, well, can we try it? And all the employees tried it. And all the employees were like, I love this product. And so at that moment, I said, well, if the employees like it and my wife likes it, okay, let's go ahead and let's get it. Sorry, it's getting a little dark here. Let me turn some lights on. The sunset. So the other thing that happened was, it was this photo. We posted this photo and we got a tremendous feedback from people on our typical Instagram. We get about 1.5 million people that look at us, 1.4 to 1.5 over basically a 30-day average. And we got a huge interest level that really, really peaked on that product. And we said, okay, well, let's bring this in and see how we can use it. So we brought it in. We let the other employees at the office. And this product honestly was the highest feedback we've ever gotten out of any product ever. Microneedling probably is a close second, but this product is, and Botox, I guess. This product, though, everybody loved it. And everybody was able to do it. Whereas some people can't tolerate the microneedling. Some people don't like needles, so they don't like to get Botox as often. This is a very easy product. Mix it up, put it on, super easy. And it was loved by the employees. And that got me to thinking, okay, if all the employees like this, how can we utilize this product? Because in full disclosure of all those before and afters that we showed, it really took me until we started using this in April. It took me till about, I think, August, September to really start to feel comfortable where we were utilizing this product more and more from our surgical standpoint. And we decided, well, why, if it's loved this much, why don't we make this CO2 lift part of our experience? And hopefully this is very helpful to everybody else because I know the economy is slightly dipping down. So I'm going to spend a couple minutes on this, but I really think this is some high yield stuff that I hope people will get some usage out of. We decided to actually make it part of the experience because it was liked so much, because you can see an immediate sort of effect in that sort of glow or radiance of your skin, and because your skin actually feels softer and smoother. So our thoughts were, well, this is kind of cool. We'll do skin analysis of people anyways when they come in for consultations. We'll offer them the mask. At the period of time while we're doing the consultation, it roughly takes about 45 minutes to an hour that they're there as we're doing sort of the consult, meeting different people in the office and getting their surgical quote. The idea was, well, when that mask peels off, that should be around the time that the surgical sales quote is being given. And if we have a personal testimonial given, and that they see that what we say to them actually works, then that should translate into us having more sales consultations because of that personal testimonial that they can tell us. And I sort of jumped ahead of myself, but for those people that are sort of scratching their head a little bit what I said, I just want to take a really quick moment and just talk a little bit of sales theory, okay? And so what motivates people, right? Why do people seek out services? And really, in our industry, it's a lack of fulfillment. That doesn't necessarily have to be negative lack of fulfillment, but it's just, yep, they're wanting something more that they can't get. Maybe they're wanting bigger breasts. Maybe they're wanting a more toned torso. The gym isn't providing it completely. Maybe despite them doing all their other treatments, their skin isn't looking as good as they want. So something is not being fulfilled. And therefore, because of that lack of fulfillment, they're seeking us out. Now, if you've ever gone to Hawaii or anywhere else, well, let's say Fiji, for example, the vacation is always sold over the trip. And what I mean by that is, if you think about it, whenever you think about Hawaii or Fiji or any of those places that you love to go to, your immediate thought, if you want to go back and you like it and you're happy, is about those beautiful beaches. It's about the rich culture. It's about the great food. It's about how much fun you had. It is never, ever about that 8-hour plane flight that you took, that maybe you were crammed in coach, or you had that screaming baby sitting next to you, or the terrible airplane food that they tried to serve you, or the turbulence that you hit over, or the fact that your luggage got delayed somewhere else. Because in general, if people sold you on the actual trip itself, no one will go on vacations, right? That's just human nature from ourselves. The goals always outweigh sort of the mechanism of how to get there. So how do we sell, quote unquote, the goals of surgery or any procedure that you're doing? And we thought, well, this is great. If we have a product that we can actually show you is going to do what we say it's going to do, then you will believe both in us and in the products, and that what we're saying is truthful, and that we can actually take you from where you want to where you want to go, and you can feel reliable and safe that we will do it. So we started to offer all of our patients this, and that was it. That was the whole goal. Just, hey, listen, let's offer the people, let's see what happens. Hopefully it should help out. And we started to realize that whether or not people took a CO2 lift, we could actually start predicting a little bit of their behavior. And what we actually saw was, you know what? Some of these numbers are actually a little bit old, because it's actually closer to 90% now. We knew that actually if people accepted the CO2 lift, if we pulled out over a 3-month period, that's a 90% chance that they're going to close. That says the same day close rate actually fell a little bit to about 70%, but that's right. If they declined the CO2 lift, we actually saw that there was less of people that actually did a same day close rate, right? And again, we push out further, obviously it changes. What we found, interestingly, was that CO2 lifts that just said, that accepted the mass, but said, no, we just can't do it. It was usually a price issue. Just our price was not able to match their price, or the procedure that they were looking at just wasn't something that we thought was actually going to get them to their goals. A good example of it came in for breast augmentation, but we looked at, they had severe breast sag and we had to do a breast lift with the augmentation. They absolutely didn't want to do the breast lift. So it was just our treatment plans didn't align up with their goals. And that was it. That was why people said no. And that's super cool, right? We were like, oh, this is awesome. Look at this. Like, we know based on whether they say yes or no to CO2 lift, it's going to actually help us out. But I started, collecting the data, because I'm a big data guy. I love data. And we started to say, well, what about these people that say no? What's the reason that they say no? And so over time, we started to look at this, and we started to see, okay, what are the different reasons that people are saying? And this is actually where stuff gets super cool. So that old slide was a little bit older data, because I've continued to do this. We've really narrowed this down to about 4 or 5 groups of people. Number one, the first group of people says, I don't want a CO2 lift. I'm in a hurry. I'm too busy. Awesome. What we realized was that group of people that says that actually really value fast, efficient consultations. They don't want fluff. They just want, hey, look, I'm a sort of a professional, quote unquote, quick. I want things delivered to me in a way that obviously is safe and that I can understand it, but I want things fast and efficient. Awesome. If we had people that said, I need to learn more about the product, we realized that these people, kind of the exact opposite, actually valued a lot of information. They value actually long backstories. We actually can't flood them with enough information. The more we can, the more they actually felt a connection that we were actually delivering the info that they wanted. We found that some people say, well, does this CO2 lift actually work? I need to actually see some before and afters. I like to actually like what this does to my skin. And we realized that those people valued an image-focused consultation. Now, it's plastic surgery, or it's aesthetic surgery, or it's aesthetic. So there's so much before and afters anyways. But this group of people, that's all they wanted to see. Before and afters images. When we were talking about the plans, that for them, they really wanted to see their before up. They wanted to see what we were going to do. Question of, well, I'm going to hold off on the CO2 lift because I just got to learn if this is safe, if I can use it. I don't know. I've got all this other stuff on my skin. I don't know if that's going to interact. And we realized that these group of people actually valued a consultation solely delivered with the aspect of safety in mind. Now, I know all of us here are always safety is always forefront in mind for all of us. But this group of people, that's what they want to hear, because that's what's most important. We had another group of people that basically just said like, hey, I've got makeup on, et cetera. I just can't do it. And for those people, we would use that to actually invite them back for another CO2 lift with the staff. So we actually get them back in the office. It's just kind of like another way to sort of pull people back in. Now, super interesting. We had groups of people like, I'm not interested. And when we looked, I don't care. I'm not interested. When we looked at those group of people, they had actually such a low yield of conversion or consultation. They result in only a 5% booking rate. So we actually knew when someone said that we're like, you know what? This is not this person is not likely going to mesh with our practice or whatever. They just are not going to feel the fit there. This is something that while we can give them whatever information we want, this is not a sort of good fit for our practice, and it won't be. And so that's actually really helpful too when we are contacting patients after surgery, hey, just want to make sure that you got all the info, et cetera. These people typically will ghost us and just never respond. And for a very long time, we would follow up. I wonder why this person's not. But what we've seen is just the data, they're just not gonna reach out. So did this matter? Like, did it matter that all of a sudden we were able to look at all these different groups of people and sort of stratify consults based on the behaviors that they exhibited CO2 lift? And the answer is it did. We actually increased our conversions by 10%. And so this is actually pretty wild. Again, that's in that subset of people that weren't booking with us. It's pretty wild. And why? Like, why do I think that is? I don't really think it's any hocus pocus things we did. I just think we were able, once we started to look at it, utilize a product that's actually a very sort of low cost product. It works very well, but it's super cool. It's a very low cost product. Add it onto an experience. By that, we'd be able to determine what kind of behavior that they represent, and then actually deliver a consult that meshes specifically with that type of behavior, what their number one priorities are. So essentially, in many ways, delivering them the consult that they seek for. And we were able to do that. And then we saw higher sales conversions from it. And so this is actually a super cool aspect. As you can tell, it's a passion of mine. I love data. I love behavior psychology, et cetera. But it's just a really outside the box way that we actually have really seen a benefit in this product. In addition to all the other surgical sides that you see, we've actually found to leverage it this way too. So it's just been a really wonderful addition to our practice. Again, here's just a little info about I believe this is still accurate, Lauren. Is that right? This is on their branded stuff, so I included it. So as you can see, treatment cost averages $5. So I mean, it's just for $45 to increase the surgical sales by 10%. This is one of the best ROIs I think you're ever going to have in your life. And that's with that. I'm going to end it. Any questions, etc. We are doing a scar treatment. We're doing on lipo scars. I'm doing a 5-day treatment of it, days 1 through 5, where they come in. We're only putting scar gels on one side of the body, which is actually super cool because we're looking then to see, okay, can we see, one, does the patient feel that there's a difference in the scars? Number 2, does the examiner feel that there's a difference in the scars? And number 3, when we do a double blind, we're actually going to take photos. We are taking photos of each side, and then actually we know whether or not the CO2, what side CO2 lift was put on, if at all, are people, when we ask them, seeing a difference in it. So super cool. More to come.
So excited to hear about that. We do have some questions, Dr. Nykiel, and
love questions.
That's the first time that, I know you've talked about the psychology of the consult and how it's really assisted you in that, but I love how it's broken down, like, how you're able to really tailor the consult specifically for each, indication of feedback. So it's so compelling and interesting. But
I think yeah. when I did this talk way back when, God, I think it was like August. I think we just started using you guys like April, May. So while we had some data, we didn't have, all that data then that we could break these down even further. It's and we continue to. It's super cool.
It's so cool. Well, so one of the questions, actually, I'm going to flip around a little bit. So I apologize if I'm but just kind of on that note, someone had said, because you said yourself, like you were a little hesitant to use it in surgery, and now you're starting to use it more on the surgical side, but you started more on, let's call it the med spa side, or on just non-surgical side, right? With just consults and just standalone. Would you suggest a surgeon to start in that area, or would you say, hey, like just jump right on in? Or how does someone get started if they have a full surgical suite and and non-surgical side as well?
So I think most of us as surgeons in general, we're just leery on trying new stuff. I think that's just the nature of surgery. So it would be hard for me to recommend to a new surgeon to do something different than I didn't do. We started with new patients and we started on the med spa side because it allowed me to get comfortable and see it. And actually, honestly, I would use it myself after, and actually, I'm going to include those photos next time. But I would do, facial procedures or injections with my nurse. I'd have some redness, some inflammation, or if I did peels, and we would actually apply that mask. And my drive typically from the Upland office is about an hour. And when I would get home, I would take that mask off, and the redness, I don't want to say it's gone completely, but it would be significantly improved. I was like, I can't believe that this is actually happening. And so from that, it really gave me confidence to start using it in other locations. I think for most surgeons, when you talk to them, they're going to give you the similar story about the first time they used it. It was, yep, I really want to get this person into hyperbarics. It was like a Friday night at like 4 p.m., 5 p.m. They weren't open on the weekend. So I just said, well, I'm gonna give you a couple of these we'll apply packet here in the office. I'm gonna give you a couple of these to take home. I want you to continue to use these, and then I'm gonna see you, in a couple days also. And with that, you see improvement.
Love it. A couple of people had asked just about the size, right? So with diabetic ulcers or with the areola, and one treatment does kind of cover the surface area of one face, maybe a little bit of the neck as well. But and also
A
just
thick of
one.
application too. You know what I mean? Because we use it so much, like it's a good amount. You know what I mean?
Yes. But if you have a smaller area, they're saying, can you save it? But we don't recommend doing that because just can be oxygenating with the air, and then it's going to mess up the whole chemistry of mixing it and actually creating the CO2. So at this point in time, we don't have a smaller version. So, and I think, I don't know if you agree or not, but if you're using on the areola, why wouldn't you use on the other side? But then also, why wouldn't you cover the full breast? Because it's just oxygenating all the area around. But any other feedback or comment on that?
Well, the other thing too is if you mix the whole thing up, it's gonna solidify and set in, right? Because so that would be the other thing of why I'd say you can't save it. It's sort of like a one packet, you mix it, and that's the full use because it's going to firm up and harden. And it's sort of almost like a rubbery plastic type of material. So that'd be the other reason why you couldn't. I totally agree with the chemistry aspect of it for sure. But I think just even from a physicality, it's not even an option. But don't try to make it an option because the chemistry will throw it off too.
Right. And I usually say, I'm sure there's some kind of area, like think literally head to toe. If it's not, if you're applying it just on the breast, then why not put it on the face or your elbows or knees or wherever else you might be needing a little bit of love on your body, since it is, super versatile that it can be used anywhere and everywhere. So just extend the use of it.
If I was in a situation where, I was doing let's say a fingertip or just the areola, I think I would lather up the fingertip or areola well. Yeah, there's gonna be a lot of leftover product, and I'm probably gonna say, hey, this works really well on the face too. It helps to moisturize. It helps to. Would you like me just to put it on there also? Happy to do that. I think that's just goodwill. They'll absolutely see a difference, and I just think they're already going. You didn't want that wound or complication issue. They don't want it. So anything that you can do to just show that you're there to help, I think is just a win for you.
Absolutely. Love it. Back to the picture where they had the plastic and it said that it was on for 12 hours because this person had asked, they said that they thought that the max time was 45 minutes. So I know some of your colleagues are using the plastic wrap to kind of keep the moisture in because then it doesn't dry out and it doesn't set as much. Have you used plastic wrap at all?
I have. So in general, when my colleagues I know that do that, or myself when we do it, I think the other reason too that we do like that is when you use the product, it's interesting. It goes on, it sets, and then kind of after about 45 minutes to an hour, it's like smart releases, right? It just kind of starts to fall off, and that's when you know to sort of peel it off. So the benefit of putting the plastic wrap on is it just keeps it on there. In the situations that we find that I find that useful is, let's say that it was a post-surgical patient we want to apply to. We're likely going to see him back the following day. So we put the CO2 Pro Lift on, we'll put the plastic wrap on, and we just say, well, come back in, we'll take this off, we'll change it. For some people, we'll put it in right after surgery, and that way they can put the plastic wrap on, still put other compressive garments on, etc., and then be able to take that off and help fix it.
I'll say too, I'm 8 weeks post-surgery in my own surgical journey, and I had my flanks done as well. And so when I was putting it on, I just put plastic wrap on just so I could lay back down again, because you're weak, you're tired, I had everything done. So, that was just more of a convenience factor too, just to kind of keep it intact and to keep it from getting on your clothes or on your bed or whatnot too. So you can easily put that plastic on. It's not necessary. You don't have to include it. It's just more of a convenience, like you said, just, to keep it more intact. Another question, do you do facelifts? And if so, when do you apply CO2 lift? After suture removal, do you use it on all of your facelifts?
So I do facelifts. So facelift, skin flap. So facelift, tummy, breast lifts. I think honestly, tummy tucks probably got the most ischemic flap out of those. The beauty of the face is how well vascularized it is. It's such a unique zone. In all of those, CO2 lift can be applied right there. And if there's ever a situation, whether that be tummy, breast, face, where arm, thigh, where a flap has been lifted, and I set it down and I look at it and I think, I don't really like how that it's I'm just where I don't feel good about it. We'll put the CO2 lift on right there, and then we'll do it the next day too.
Yeah, I think a lot of our surgeons have been saying that they started using it for rescue and now they're using it for everything just because it's almost like a why not? If you if you can help salvage or if you can help prevent potentially, then why not use it in all cases? And
And
so yes,
and
yes.
the uses, I'm sorry, Lauren, and the application cost is reasonable. You know what I mean? That it's such a okay, let's try this. Let's use it. It makes sense. It's not something where you're talking about like, $500,000 a pop to use. It's I think $45 is what our slide was. So great. Try it out. Use it. And you say, "Oh, yeah, this helps. This is worth $45."
I think the only instances where there's been some questions is if there's a dermabond or something like that. Can you put it on top of the dermabond or will it break it down? So I
Right.
know there's a couple of things that we do have out there that some of our surgeons, Dr. Salcedo is working on kind of some tests for that. But other than that, like even if there's a surgical tape or something, they're just putting on the surrounding area because it's bringing that blood flow to the area. But then as soon as possible, I believe that's what Dr. Hoyos has said. As soon as you can get it on, the earliest that is the best, right? So to help with, hopefully we'll figure this out too with the scarring and whatnot. The sooner the better. Is
So
that
yeah, if you think about the mechanism of action, it's transdermally absorbed, right? So I completely agree with you. You put it around the surrounding areas, it's going to increase some blood flow, which should increase blood flow to that area too. But I think obviously you say, well, the more that it's in direct contact, will that improve the transdermal absorption? Well, of course, to some degree, right? So I agree with you that if there's steri strips on, if you're able to remove the steri strips and apply it, that's what I would do for sure.
Yeah, and this kind of in the same realm of things. Talk about how the product comes as a mask versus as a sterile gel, how long you leave it on post breast lift on scars, apply immediately post-op day one. Tell me your protocol.
So the product isn't sterile I mean, I wouldn't necessarily say it's a sterile product.
Manufactured in a sterile facility. We don't claim sterility,
Yeah.
but as long as you're using utensil, the bowl and the stir stick and everything if those are sterilized, then I mean, again, it's manufactured in a sterile facility and it's vacuum sealed. So
And so the way that I'd say is just like when you're putting on your top layer dressings, yeah, I think that's a pretty good sort of usage. I would say that you can put it on right there surgery, and we have. There are a lot of docs that do. From my protocol has been this, and I can tell you that everybody's protocol differs slightly, but we will send patients home with 5 of the treatments, and we say, do this 5 times. We want you to do it. And then typically I'm going to see them either the following day or basically every other day. And we'll add a treatment on that day that I see them. And then I can tell them they can add their other one. So it's typically 5 days of treatment that we do at a minimum every day. For me, that's worked nicely. In general, I can tell you it kind of started like 2 treatments, then 3. I think most people are hanging out around 4 to 5. It's just the beauty of this again is just you're able to do it at home. You're able to do it at home. They're able to do it. It's a treatment that they can do. So that's why I really like it. Kim, I think you asked this. So the other thing I want to ask, if I feel that somebody needs hyperbarics, I'm still sending them to hyperbarics, right? I'm not to the point where I'm not doing hyperbaric treatment, and I wouldn't say that. So if you were ever looking at like a nipple or skin flap that you're like, this needs to go hyperbarics, do it. For sure, I'd still send it. I still would. I found myself in issues where either hyperbarics can't get them in, they can't get rides, or they're not open on, basically Saturday, Sunday that we want to send them. And then we've utilized that CO2 lift and we'll see them back on Monday. And it's actually amazing what has happened. So super cool.
Yeah. Someone had asked about just if there's any benefit of leaving it on longer, like if you are using the plastic wrap. And there's no additional benefit that we've seen because the CO2 is only active for those 45 minutes. So there's no benefit. Again, it's just kind of more convenience. Yeah. Some other things. So we see, there was a scar question. Does it work well with scars that are more than a year old? We don't have any scar studies specifically on older scars. I don't think it could hurt, but I think most of our providers have said you want to break up that scar and then you'd be using the CO2 lift for that. But what are your thoughts on that, Dr. Nykiel?
Well, I think that's part two of our study that we can do. But I will tell you that possibly. So if we look at one of the original indications for carboxy therapy, right, it actually was stretch marks. And so they would insufflate the CO2 into the stretch mark area, and they would show improvement in both collagen formation and therefore just the overall aesthetics of the stretch mark itself. So I kind of think, well, maybe it might. I haven't tried it. I don't have any data to support that, but that is one of the indications for carboxy therapy. It's stretch marks or scars because of dermal tearing. Yeah, it's possible.
Love it. And scarring as well. Does this reduce keloid scars?
I don't know the answer to that. I would be hesitant to say yes, because I don't think we've really worked out completely the mechanism for keloid or even hypertrophic scars. Obviously, tension doesn't help, and therefore I don't know that it would benefit from that. And I haven't heard anybody discuss anything like that. Have you, Lauren?
No, I have not. No. Not yet. Still more to come. I mean, that's the great thing about the versatility, and I always say universality. And someone had asked about side effects. We say it's for anybody and everybody. There's no one that can't use it, and I think that's where we started talking about where it would be a good consult tool because anybody walking through the door, it's going to be beneficial for, right?
Yep. Yes. Yeah. I see Wes had a question about, did I offer the CO2 lift at the time of the consult or before it started for free? How do you make use of the 45 minutes and then deliver consult? Okay. So yeah, when consult, so technically it's for free. We charge for consults. So that's kind of like getting a free breakfast at the hotel that you stay at. You're paying for it. It's baked in there, but you feel like it's free. So we all, that's right. People come in, consultation, they meet with our estheticians and basically our nurses from the med spa, and they say, hey, part of this is we do just skincare analysis. We have some skincare machines that obviously can analyze your skin. And then it's just, would you like one of these? Would you like a CO2 lift mask as part of the consultation? We just, want to help treat your skin and help you out. And so they would say yes. So the application time, 5-10 minutes. What do you think probably is realistic? So it's a great time for either our nurses or our estheticians to actually get a little one-on-one time, talk to people, understand what their concerns are, see if there's actually a crossover to our med spa. So it's really helped from a crossover conversion standpoint because they're there, which is another part of this I didn't talk about. Then once the mask is going on, actually our patient care coordinator goes in, speaks with them, understands what their goals are, talks with them. And then typically I will come in after that, do the exam, go over what their goals are, do the exam, go over the procedure, talk about their healing timeline, treatments, risk of the procedure. And then the goal is that after that sort of 45 minutes is up, they've met with the esthetician, they've talked to the patient care coordinator, myself, and now they're receiving their surgical quote. That should roughly be about the time that mask is coming off to show them the testimonials of it.
Love it. I think it's just so smart. Just because we're coming up on the hour here, so I'm just gonna quickly answer some questions. Someone asked about red light therapy. We don't have any studies that show that the red light can actually penetrate through the gel. We do have a lot of providers that do like to use them in conjunction, or you could always have it on the face and do red light for the rest of the body if you have the beds. But we do have a lot of providers that like to use both of them together. Chemical peels, as soon as the peel has been neutralized, they're utilizing the CO2 lift.
I've personally used that, Lauren, the chemical peels on myself. It's amazing. That actually started to give me, someone asked me about the confidence. That actually started to kind of get me the confidence to be like, okay, maybe I should start using this on some of my soft tissues after surgery because it worked. Amazing.
Yes, love it. Yes, absolutely. And it's funny because a lot of people think that peeling is the thing for peels, right? But it's actually, you don't want to peel. So, and a lot of people said that, when they use it, that's the only downside to it is that they don't peel as much and they feel that that's what makes it work, but it's counterintuitive. So would it be beneficial prior? So pre-treating, I know a lot of our doctors are starting to get into this pre-treating, especially with radiated tissue. Dr. Zeidler had talked about that specifically for radiated tissue. She said every single one of her patients that has gone through chemotherapy before they go into surgery, she's prepping them. Are there any other specific places where you use for pre-treatment to prep prior to surgery?
That'd be my thoughts. Like true, people with healing issues, radiated tissue, people who either just finished chemo. If I was doing some complex breast revision, maybe and the tissues didn't look that good, or maybe I was doing like a tummy tuck revision and it just looked a lot of scarred, irritated tissue. I was concerned about how that would heal with after I lifted the flap up. Then potentially Spanish, I would. I don't use any pre-treatment as of yet.
Okay, great. Yes, I know sometimes it's some people have been doing that, especially we were talking about that earlier on for labiaplasties and for vaginoplasties. There's one of our doctors in Dallas who will not even do a vaginoplasty anymore on her patients unless they pre-treat with a full protocol of the CO2 Lift V. So I think it can be beneficial in certain scenarios. The longevity of the results for fine lines and wrinkles, we found that it just continues to compound and, with the monthly maintenance. But I think, yeah, for fine lines and wrinkles, you're going to just continue with a monthly maintenance to help maintain the results.
Can I add that, Lauren?
Yes,
I mean,
please do.
I get, and again, I've been using this product longer than everybody, obviously on this, the newcomers listen to the webinar, but the product works well enough. It makes your skin look good. Like I think you guys sell them in like a 3-pack or something else. Like I just feel like the monthly maintenance thing to me is like, okay, I think easily you would use it once a week. You know what I mean? Like, cause I think like just you'd use it probably every Friday night before you would go out. Yeah. So just for everybody to kind of listen to it, like the product works well enough. I just don't think you have a compliance issue with this product at all.
No, definitely not. And yes, absolutely. When we were talking about protocols for post-surgery, we've been saying 3 to 6, and that's kind of based off of what we've been hearing with Dr. Hoyos' study and some other studies that we've seen. But there's no limit either to how many. I know, again, kind of going into my own surgical journey, it almost like felt like it was alleviating pain. It helped make me feel better. It was something that I could do, that I had control over the healing journey, because it's a psychological, it's a big, it's a big undertaking. So it's something that you have control over. And again, it's so convenient to do in the comfort of your own home. So would this be beneficial prior to, sorry, I already answered that. Maintenance, 1 a month, 2 a month, like Dr. Nykiel said, 1 a week. That's perfectly fine too. Jet plasma, it's good with that. Yes, we have people bundling it in with their lasers, microneedling. How many sessions after microneedling? How many are you doing after your microneedlings right now, Dr. Nykiel? Are you just doing one, or are you encouraging them to do them 3?
We just apply one after they go. I mean, the product works so well; it just takes care of it, and people like it. It's a true mask. Like, I think there's always it's a true mask. So it's a great product. Do one.
Yeah,
Most
I think with
people buy more of
microneedling, one is great, and then of course, just for skin quality and everything, then you'd want to do the minimum of 3, and then going into your maintenance. So no side effects. You can use it with jet plasma. It's okay to apply after the Pico Pro laser for hyperpigmentation. I'd say the only time that you want to wait a little bit is if you have a laser or a device that creates that deep heat. You want to cool down the skin first. But other than that, immediately after pretty much anything and everything else. And I think we got to all of our questions. I know we're a little bit over time here. So you guys can always submit questions to us. You can DM us on our page. Our Instagram handle is at CO2Lift Pro. That is our provider page where we share and just basically just repost providers' pictures and providers' before and after photos and results. Our CO2 Lift is kind of more consumer facing. You can email us at support@CO2Lift as well. My personal email is lauren@CO2lift.com. And of course, you have all the contact information for Dr. Nykiel here. Is there a preferred way of communication with you, Dr. Nykiel?
Any of those, I don't check email, but honestly, I'll probably check WhatsApp or text to my phone. And I welcome anybody to contact me. I really do. We're happy to answer any questions that you have.
Thank you. And we're going to be starting up actually specifically for plastic surgeons, a WhatsApp chat group where people can be asking some more questions just in a more peer-to-peer setting that's specific for using CO2 Lift post-surgery or pre-surgery for that matter. So, okay, guys. Well, thank you so much for hanging out here with us tonight on this Monday night. And Dr. Nykiel, thank you so much. This was absolutely amazing. I think this is the first that I've heard information like this from more of the business side of things and how you can really dive deep into the psychology of the patient in their consult journey. So it's just very, very interesting to hear how this is being used, and can't wait for the update on the SCAR study. So that'll be webinar 2.0, right?
Yeah, exactly.
Yes, and yes, we will be sending out a video of this for all that might have missed the beginning or want to re-listen or share with their peers. The link will be sent out probably by tomorrow to everybody to watch. And for those that missed us live, then of course you're listening to this on the recording, and feel free to reach out to us with any additional questions. Thanks so much. Thanks, Dr. Nykiel. Have a
Thanks,
wonderful
guys.
day.
Appreciate it.
Okay, bye-bye. Bye, guys.
Okay.